Diarrhea can be defined as the passage of loose, unformed stools. Diarrhea may result from a variety of factors and conditions including intestinal malabsorption disorders, increased secretion of fluid by the intestinal mucosa, and hypermotility of the intestine. The related factors of diarrhea may include stress, anxiety, side effects of medication use, laxative abuse, gastrointestinal disorders, motor disorders, irritable bowel, mucosal inflammation diseases like Crohn's disease or ulcerative colitis, malabsorption conditions like lactase deficiency, increased secretion, enteric infections with viral, bacterial, or parasitic organisms, disagreeable dietary intake, tube feedings, radiation, chemotherapy, surgical procedures, bowel resection, gastrectomy, short bowel syndrome, alcohol abuse.
The subjective data for the nursing diagnosis diarrhea may include abdominal pain, urgency, and cramping. The objective data for the nursing diagnosis diarrhea may include hyperactive bowel sounds and at least 3 loose liquid stools per day. The expected outcomes for the nursing diagnosis diarrhea may include client will reestablish and maintain normal pattern of bowel functioning. Client will verbalize understanding of causative factors and rationale for treatment regimen. Client will demonstrate appropriate behavior to assist with resolution of causative factors like proper food preparation or avoidance of irritating foods. Now let's discuss the possible interventions for this diagnosis. Obtain comprehensive history of symptoms and physical examination including tolerance to milk and other dairy products, medications the patient is or has been taking, food intolerances, methods of food preparation, change in eating schedule, current stressors, previous gastrointestinal surgery, gastrointestinal diseases, abdominal radiation, foreign travel, ingestion of unpasteurized dairy products, or drinking untreated water. Comprehensive assessment help in identifying cause and treatment needs for the patient. Assess for abdominal pain, cramping, frequency, urgency, loose or liquid stools, and hyperactive bowel sensations. These assessment findings are commonly associated with diarrhea. Perform a stool culture. Testing will identify possible etiological organisms for the diarrhea. Assess for fecal impaction. Liquid stool may seep past a fecal impaction. Assess the impact of therapeutic or diagnostic regimens on diarrhea. Preparation for radiography or surgery and radiation or chemotherapy predisposed to diarrhea by altering the mucosal surface and transit time through the bowel. Assess hydration status, including input and output, skin turgor, and moisture of mucous membranes. Diarrhea can lead to profound dehydration. Assess the condition of perianal skin. Diarrheal stools may be highly corrosive as a result of increased enzyme content. Explore the emotional impact of illness, hospitalization. Loss of control of bowel elimination that occurs with diarrhea can lead to feelings of embarrassment and decreased self-esteem. Give anti-diarrheal drugs as ordered. Most anti-diarrheal drugs suppress gastrointestinal motility, thus allowing for more fluid absorption. Supplements of beneficial bacteria, also known as probiotics or yogurt, may reduce symptoms by reestablishing normal bacterial flora in the intestine. Provide the following dietary alterations: bulk fiber like cereal, grains, natural bulking agents like rice, apples, matzos, cheese. Bulking agents and dietary fibers absorb fluid from the stool and help thicken the stool. Avoidance of gastrointestinal stimulant foods like caffeine, carbonated beverages. Stimulants may increase gastrointestinal motility and worsen diarrhea. Encourage fluids to 1.5 to 2 liter per 24 hours, plus 200 milliliters for each loose stool in adults, unless contraindicated. Consider nutritional support. Increased fluid intake replaces the lost in the liquid stool. Provide perianal care after each bowel movement. Gentle cleansing of the perianal skin after each bowel movement will prevent excoriation. Barrier creams can be used to protect the skin. For patients with enteral tube feeding, change feeding tube equipment according to institutional policy, but no less than every 24 hours. Contaminated equipment can cause diarrhea. Administer enteral tube feeding at room temperature. Extremes of temperature can stimulate peristalsis. Initiate enteral tube feeding slowly. Starting a tube feeding at a slow infusion rate allows the gastrointestinal system to accommodate intake. For patients with enteral tube feeding, decrease the rate or dilute feeding if diarrhea persists or worsens. Decreasing the rate of infusion or osmolarity of the feeding prevents hyperosmolar diarrhea. Teach the patient or caregiver the importance of good perianal hygiene after each bowel movement. Wet wiping or cleansing is most effective. Do not use wipes that contain alcohol or perfumes. Dry perianal area thoroughly by patting and not rubbing area. Use barrier creams to prevent excoriation. Hygiene reduces the risk of perianal skin excoriation and promotes comfort. Teach the patient and caregiver the importance of hand washing after toileting or perianal hygiene. Most acute diarrhea is caused by enteric infection. Good hand washing will prevent the spread of the infectious agents.